Good afternoon, everyone. My name is Fahad Shahid, and we are live from Prime Hospital page. Uh, Thank you, everyone, who all are going to join us today, talking about the antibiotics, misuse, and resistance. That is very, very, very important topic that needs to be discussed. And as we are in the currently, we are into the week of antibiotic awareness. And for that, I have the right person, the right doctor with me, Dr. Dayar Abdullah, who's the consultant internal medicine at Prime Hospital, chair of medicine, chair of antibiotics stewardship program, ASP, and member of UAE National ASP Committee. Doctor, thank you very much for joining us, giving us time today. You're welcome here. Doctor, talking about antibiotics, obviously it's for a great use for the patients, but when it comes to the other side of the picture, talking about the misuse and resistance, it's really very important that patients and all the everyone should be aware of it. So, doctor, talking about the antibiotic, I would like to just ask you first of all, regards to the session that we are doing today. What is Antibiotic Awareness Week, and what all of us need to know about it?
Thank you, Mr. Fahad. Assalamu alaikum wa rahmatullah, everyone. Good afternoon to you all. We are here to talk about antibiotics in general. And every year, WHO and all over the world and in the European Union also, and we are celebrating this occasion, which comes to increase the awareness of the professionals, doctors, and of the public about the risk of overusing and misusing antibiotics. So it's a full week and it's full of events all over the world and at the national level, international level. And this is what we are doing today to increase the awareness of public about this issue in simple words, hopefully to answer all of your queries and questions. And if you have any questions in Arabic, حياكم الله, you can بتقدروا تسألونا الأسئلة باللغة العربية كمان، وأنا مستعد للإجابة عليها either in Arabic or in English، بالعربي أو بالإنجليزي إن شاء الله. الله يحيي الجميع. Yes.
Great. Thank you, Doctor. Doctor, as you've told about the awareness on the week, there is a question that I really would like to ask, and people would like to know, though we are giving them antibiotics for the treatment, but what are antibiotics and what is antibiotic stewardship, Doctor?
Well, antibiotics actually it's a great invention in the history of the world. And to start with, if you remember, I'm sure you read about the Spanish flu in 1918, which killed almost 1/5 of the world population. And it was found later on that most of these deaths could have been prevented if antibiotics were available at that time. But it was not before the mid of the last century when the penicillin was discovered. And it was like the greatest invention maybe in the medical history, saving millions of lives, because as we all know, the viral infection, influenza, it may start as a viral, and then if it will kill the patient, it will kill him or her because of the bacterial infection that will follow the viral infections. That's why in a certain category of patients, we start antibiotics to prevent these complications. So it's a great invention. It is designed, antibiotics, as the name stands for, anti, against biotics, bacteria. So it's medication designed to kill the bacteria, not the viruses. If we are talking about the antibiotics specifically, not the antimicrobials in general. So these are the antibiotics. And what we need to do currently, and what's done in the last few decades, what we call it antibiotic stewardship program, which is a program overlooking the use of antibiotics in hospitals, in community as well, in public, to increase the awareness that these antibiotics, they are not for common viral infections. Awareness even inside the hospitals that not all of the infections requires strong antibiotics to be treated, as this will initiate what we call antimicrobial resistance, when the bacteria will become resistant to this antibiotic. If the next time antibiotic, the same will be given to treat this bacteria. So stewardship is very important. It's to control the use of antibiotics, either in the hospital or at the public level, where many patients, they are using on their own without a medical prescription for their common illnesses, which doesn't need which don't need antibiotics.
Thank you, Doctor. So, you've made it very clear that antibiotics are for the bacteria, not for the viruses. So just people who are actually listening, this is really a very important thing that we really need to know. Doctor, is antibiotic resistance an important issue? How does antibiotic resistance happen?
Well, when we give antibiotics for a disease where no bacteria is there, the common bacteria, which we call it flora in our body, they develop a process called resistance. They change themselves, they adopt themselves or adapt themselves to become resistant to the same antibiotic next time. So it is not the human being who become resistant to the antibiotic, it is the bacteria inside us which will become resistant to the antibiotic, most likely because we use a lot of antibiotics for common infections which they don't need antibiotics. And what is the second part of your question, Mr.
The
Fahad?
second part I asked you, doctor, that is how does antibiotic resistance happen actually?
Yes, it happens at the gene level of the bacteria, where changes inside the bacteria. Bacteria wants to live like we want to live. So, and will do whatever it takes for the bacteria to live. So it will adapt itself, it will change the genes, and it will come up with the new ideas to survive by becoming resistant to certain classes of antibiotics. That is why it is important. Do not take antibiotics for any infection which doesn't need antibiotic, because next time you will have a serious infection, God forbid, the real antibiotics will not work efficiently for you.
Great. Just wanted to update to our audience or currently watching us. If you have any questions, please feel free to put it in the comments, and Dr. Dirar will answer your questions. As he rightly said, that he is all good to go to answer the Arabic questions also. So we have Dr. Dirar available for both languages. He'll be answering your comments, your questions in the comments in Arabic and in English. Thank you. Doctor, what is the single most significant factor driving increasing rates of antibiotic resistance?
Well, there are so many factors. If we are talking about using antibiotics a lot when it is not indicated, this is one of the very important factors in driving the antimicrobial resistance. We have other factors as well, because it is not only about the human antibiotics, we have the animal antibiotics and we have the plant antibiotics, where if you know the statistics in general all over the world, most of the antibiotics used at the global level, it goes to the animal industry, where a lot of antibiotics used for growth or for treating common infections, most of them are unnecessary. So, and the third one is the plant and the water, sanitation. Where a lot of factory leftovers will be thrown into water, and then the sea life will be affected with this amount of antibiotic, and this will eventually reach the human. So it is not only the human antibiotics, it is the animals, it is the plants. That is why the WHO called it, it's a global or one health approach. Human, animal, and plant. So the three factors play a role in developing antimicrobial resistance. We have other factors like travel. People travel a lot nowadays. They carry one resistant bacteria from a place to a place, and then the spread of this bacteria will happen. The travel itself, it causes some temporary reduction in the immunity. There are some something called traveler diarrhea, which also, if it requires antibiotics, this can start the process of antimicrobial resistance. But we are here focusing about the human factor, where you don't need to take antibiotic. Your doctor doesn't need to write antibiotic for you if you don't need it. And this is where the role of the patient and the public comes in, not insisting on the doctor to prescribe antibiotic, and not to be dissatisfied with the doctor if he or she refuses to write antibiotic. This is because of the best interest for the patient. So our focus is about the human, but there are other factors. Animal is a major thing, but it is not the right place to talk about it now.
Why is it important to take antibiotics exactly as prescribed, doctor?
Well, yes, when you meet your doctor and write a 5-day course of antibiotics and tells you to take it once daily, that is because of it is well studied that this antibiotic is effective over 24 hours and not over 12 hours. So the frequency of taking the antibiotics is important, whether once or twice or 3 times. The duration of the antibiotic, the longer the duration, we know it will affect the resistant badly. That's why we call always for shorter duration of antibiotics. So what we need you to do is to listen to the medical advice with regard to when to take it, full stomach or empty stomach, or to avoid certain types of food when you are taking a certain types of antibiotics. If you follow the instructions of the doctor and if you follow the shorter course of antibiotic whenever it's appropriate, then this is an essential thing to do.
Doctor, as you just said that as I also asked you, antibiotics should be taken exactly. That's really important, as you explained, that it should be taken only when it's prescribed. Now, common practices are there where antibiotics are being misused, and what can be done for that? And one question I would like to add here that there are some people who, instead of going to the doctor because of cold flu, they take the antibiotics by themselves. So, what do you have to say about that?
Yes. So what we want from public, from patients, as I mentioned earlier, we don't want you to pressurize your doctor to write antibiotics. Antibiotics are not the solution for everything. If it is a viral infection, the viral infection can cause high fever, it can cause cough, it can cause sneezing, headache. It doesn't mean that I need to take antibiotic for this one. And this is a very important factor. If you are a parent for your, of course, don't pressurize the doctor to prescribe antibiotic for your child. And if he or she refuses, please don't be dissatisfied because this is the right thing to do. And so, as a patient, listen to your doctor first of all. Don't pressurize your doctor. Take the antibiotic as prescribed. Do not take leftover antibiotics from a previous illness or from a colleague or from a family member. This is a very essential thing because inadequate courses of antibiotics, what will happen sometimes people will feel some runny nose or throat pain or some fever, so they go to the fridge and take 1 tablet of antibiotic. This is the worst thing to do. And when they feel better the next day, they will not take it. So they take partially 1 or 2 days antibiotics. They don't finish the course. And if it is even not recommended from the beginning to be given antibiotic for this one. And the good thing in this country, in UAE, that pharmacies are told strictly to follow the law, which is not to sell antibiotics without prescription. So you are not supposed to get antibiotic without prescription. But let's assume you have leftover. Please do not take them before consulting your doctor, because if it has to be taken, it has to be taken for a full course, not just for 1 or 2 days or just it is not a pill for the headache, the antibiotic. It will kill the bacteria if the bacteria is present. So it needs time to work.
Doctor, do antibiotics help with the common cold or flu?
Of course not. As we mentioned earlier, common cold and flu, it is completely viral infection. And in general, what we call it upper respiratory tract infection, pharyngitis, rhinosinusitis, or common infections in the upper respiratory tract, 90% almost of them are viral. And viruses are not killed by antibiotic. Only bacteria is killed by antibiotic. There is a small percentage, after thorough examination by the doctor, if necessary, to do some labs, some blood tests to find if there is an element of bacterial infection where the doctor will advise you to take antibiotic. It is in the minority, not in the majority. So please understand that common cold, flu, sore throat, it doesn't need antibiotics.
It's completely a viral infection. How does a doctor determine that an infection is resistant?
Yeah. So what we do, we have two parts. The first part is what we call it the patient response to the antibiotic. If we receive a patient after examination, we determine it is a bacterial infection. We give the antibiotic for the patient. We do some blood tests if necessary, not always. Most of the time we diagnose based on the clinical condition and the symptoms of the patient. And if the patient improves with the antibiotic, the fever goes away, feeling better, no abdominal pain, no diarrhea, no vomiting, the symptoms improve, means he is she is responding to the antibiotic we give. If there is no response or poor response, then we will move to the next step of doing some tests, which is, we call it cultures. Cultures, we take a sample either from the throat, nose, from the sputum, from the urine, stool. We send it to the lab, what we call it microbiology or culture, where the lab will find if there is any bacteria, what is the name of the bacteria, and what antibiotics specifically kill this bacteria. In that case, we will find which bacteria is resistant to the antibiotic we given earlier, because the lab will issue a detailed report mentioning that this bacteria is sensitive to which antibiotic, resistant to which antibiotic. And unfortunately, nowadays we are seeing a rise, or we are seeing a lot of resistant bacteria. And one common cause for this is taking antibiotics heavily. So you see the patients who are taking a lot of antibiotics, they don't respond next time because the bacteria in their body, it became resistant. So we have the clinical part and we have the lab part. And just, I forget to mention, why do we care about antimicrobial resistance? Why all of this talk? It is because the drug or the antibiotic resistant bacteria, it kills every year so many people around the world. In Europe alone, it kills 30,000 a year. And it is expected in 2050, like after 30 years from now, that 10 million people will die from drug-resistant infection. So, sorry, the number I mentioned earlier is 33,000 people die in Europe because of drug-resistant bacteria, and it will expect to rise all over the world to 10 million people, which is more than the cancer, more than the diabetes, more than road traffic accidents, all common together. Yani the problem of MDR, we call it, or antimicrobial resistance, it's a major and a global issue, and it's expected to be #1 world problem in the coming few years if no actions are taken to stop or retard this phenomenon.
Wait, actually, I was about to ask you the question Miss Maria has asked. Her question was, what can be the worldwide main risk if population becomes antibiotic resistant on a large scale?
Yes, yes. As we said, it's a famous study from UK where a prediction, if the continuous trends continue, the prediction is that 10 million people will die in 2050. Most of the deaths will happen in Asia and in Africa. So many people will suffer, of course, simply because at that time we will not be able to find an antibiotic to kill a bacteria which we were able to kill in the previous years. And currently we are seeing the same. We wish sometimes to find a bacteria which is sensitive to the same antibiotic which was sensitive to it 10 years ago. And this is what they call it 10 years challenge a while ago. When it spread all over social media, we spread another 10 years challenge showing how bacteria over 10 years turned from being sensitive, simple antibiotic will kill the bacteria, after 10 years becoming resistant to the same antibiotic, that you need to give stronger antibiotic. And always stronger antibiotics, it doesn't come without risk. It comes with major risks, and they have side effects. They can affect the kidney, they can affect the brain, they can affect the stomach and the gastrointestinal tract. So whenever we give heavy antibiotics, there are some adverse events which can lead in some situations to renal failure, to dialysis, to some serious complications. So this is what will happen if we don't do anything at the physicians levels, or the, let's say, at the healthcare level and at the public level as well.
Thank you. Ms. Mari has asked, should we be taking gastric protection medicines and probiotics along with antibiotics?
Not necessarily, no. Some patients will feel sensitive from taking the antibiotics. It will cause some pain in the stomach. Maybe briefly, we can give this certain category of patients, not necessarily the strong pills for the gastric protection. There are some liquids and some pills which is milder than the stronger pills, which we can give it for a shorter period of time. And other precautions need to be taken by the patient, which is to take it on full stomach, because some patients, they will be sensitive, but most of the patients, they are not. They take it without any stomach protection. So it's for selected number of cases, not a routine.
Thank you. Mr. Tosif is asking a question, and he says, "We have noticed augmentin is very commonly prescribed. What class and type of antibiotic is this? And also, we have noticed we noticed that this particular medicine is prescribed without a particular any laboratory test. Can you please highlight?"
Well, this is, first of all, we would like to avoid using trade names in our webinar. It's a common antibiotic, yes. It's used by many people, and many patients are coming to us asking specifically for this antibiotic. And this antibiotic is good for a certain types of infection, but it's been overused by so many patients. So a patient can have a runny nose and will take this antibiotic, which you just mentioned. We call it in scientific language amoxicillin clavulanic acid, regardless of the company which is making it. So I believe that propaganda, that media, that the work done by some pharmaceutical companies and looking into this particular medicine, it's an old medicine and efficient for a certain category of infections, but not for everything. So the golden rule: nobody should take any antibiotic, including this antibiotic, without being asked by the doctor to take this specific antibiotic. And don't come to your doctor asking for this antibiotic specifically, because the doctor will know the best antibiotic which covers the suspected bacteria in your case.
Okay. Mr. Shoaib Ahmed is asking a question. Please correct me, doctor, if I ask you in a wrong way. The question says, what we can use Metrogyl IV fluid as antibiotic
Uh,
or pills?
Pills. Well, metronidazole, we call this antibiotic, and it is an antibiotic known to treat some kinds of bacteria. We call it anaerobic bacteria, which is the bacteria which doesn't need aerobic, which is we have two types of bacteria: aerobic, anaerobic. Aerobic, which lives in air. Anaerobic, it lives with some. It's a very complicated explanation actually, but it is against a specific category of bacteria. We call it anaerobic bacteria. It's commonly given for some gastrointestinal infection and given for in dental practice common because the infection under the teeth, it's anaerobic. The air doesn't reach there. Certain kinds of bacteria are there. Respond to metronidazole, whether in the vein, with if the patient is sick in the hospital, or whether pills. So there are some specific categories and indications for this antibiotic.
Thank you, doctor. I wanted to ask you a question, doctor. What can I do to help prevent antibiotic resistance?
You can listen to your doctor, first of all. You cannot take antibiotics if left over in your house. You cannot ask your doctor and insist on him or her that I need antibiotic for myself or my family member or my child or my daughter or my son or my father. Do not pressurize. This is all what we want from you. To listen to the medical advice. You will make it much easier for the doctor to do his or her job, and do not share antibiotics between each other. Hand hygiene is very important. We are living in a COVID era now where the hand hygiene is crucial, and the overall hygiene is crucial in stopping the spread of certain bacteria, not only COVID-19, certain bacteria from one person to another person. Because what we currently see recently over the last few years, increase in the number of infections coming from community. Before, we were seeing some categories of resistant bacteria in the hospitals only. Nowadays, we are seeing them coming from the community because of some bad practices spread from here to there, inadequate hygiene, taking heavily antibiotics without prescription. As I said, in UAE here, most of the pharmacies, they don't sell antibiotics without prescription. But in other countries, you can take an antibiotic whenever you want. You can just buy it and you can take it. And this is serious, actually. And it is why certain countries, let's say low or middle income countries, where there is no strict law about antibiotics sale in pharmacies, where they have a major problem of antimicrobial resistance.
I've got a question from asking, what is the impact of COVID-19 on antibiotic misuse as people are preferring to stay at home and prefer teleconsultation?
So, COVID-19, it showed all over the world that antibiotics are used heavily, uh, unnecessarily, I will add. Because in COVID-19, if we are talking about a mild case or some mild symptoms or asymptomatic patients without symptoms, they don't need antibiotic for sure. And there is a common circulation in the media about using a specific antibiotic for mild cases of COVID, which is not true at all. It is not recommended by any authority at all to take this antibiotic when you develop COVID, mild or asymptomatic COVID. Now, patients who are coming to the hospital who are seriously sick, and not all of them, we are giving to a certain category of them when we suspect that there is a bacterial infection, we give them antibiotics in the vein. But taking a tablets, antibiotics for the common public, no. For certain category of patients, yes. Maybe for immunocompromised, for patients with low immunity, maybe for patients with some comorbidities or diseases at certain risks. So don't take it without advised by the doctor. And this is a misconcept that COVID-19, that we need to take antibiotic. It is completely a virus. A bacteria has no role in it, except in certain category of patients requiring admission to the hospital and seriously ill. We start these patients, most of them, on antibiotics because in a percentage of them, bacterial infection above the viral infection, it happens and it can affect them badly. So we start antibiotic to save them.
Doctor, you've mentioned 2, 3 times in your talk just now that previously given prescription, do not use that. I want to ask you, for example, if a patient has already been prescribed antibiotic and he's okay after completing the course, still he is left with some antibiotics, and after some days or after a long period of time, he gets the same problem again. Can he not use the same antibiotic again? He will not use it.
The patient himself or herself will not be able to tell if the infection in the new time it is the same exactly of the old time. And let's ask us one important question here: why the patient left some antibiotics from the first time? This is the important question, not why don't we use the leftover. The doctor writes you a 5-day course of antibiotic for a tonsillitis, which is bacterial tonsillitis. Why did you take 2 or 3 days and left 2 days supply in your fridge so that when you develop tonsillitis next time, you take these 2 days? The problem should be solved initially. Yeah, like you should finish the course because the bacteria which you started to treat was not killed 100% in the first time. That's why maybe you had a new infection for which you need to take maybe the same or a stronger course of antibiotic or for longer duration. So it is wrong from the beginning to take part of the antibiotic and to leave some of the antibiotic, because if you listen to the medical advice, you should not leave any antibiotics in your house.
Uh, Doctor, is there any role of vaccines that help prevent antibiotic resistance?
Yes, of course, because vaccination is very essential. Actually, this is why we advise everyone to take the influenza vaccine in the winter season, before the winter. Because if you are vaccinated against influenza, let's say, or against what we call a streptococcal in a certain category of patients, certain bacteria for elderly patients or patients with some diseases, because it will protect you from getting infected. Let's say about influenza virus, you will not get influenza. Now we know influenza is a virus; it doesn't need antibiotic. But some people with influenza, they develop bacterial infection and they will need antibiotics. So if we vaccinate these people, they will not develop severe form of influenza, so they will not develop a bacterial infection and thus will not need antibiotics. And this will help in not aggravating the problem of antimicrobial resistance. When you don't need to take antibiotic, then the chance that you will give a resistant bacteria will be much less. Other vaccines as well, it is important, like as I said, in a certain category of patients, in patients who are having their spleen removed, in elderly patients, we give them a specific, or for diabetic patients even, we give them specific vaccines to prevent a specific forms of bacteria. So if this bacterial infection doesn't happen, then they don't need to take antibiotics and there will be no problem of AMR or antimicrobial resistance. It will be less.
Doctor, you just mentioned we should not be taking the name of the trade name of the drug, but I'm sorry, I do not know, but I would like to ask this question to you.
Well, I read the name, but I will not say it.
Yeah,
Yeah.
which antibiotics prefer in typhoid fever out of these two? And after a period in antibiotic resistance by body, then what we can do? It is two comments with I think one question is followed by the other.
Okay, so this specific antibiotic which you mentioned belong to a group of antibiotics, strong antibiotics called third generation cephalosporins. It comes only in the vein, and it is effective in treating the disease which you mentioned, typhoid fever. But I guess this is not a platform where we need to discuss guidelines or treating specific diseases by which classes of antibiotics. So it is not the right platform to speak about it. And regarding the other question, after a period and antibiotics resistant by body, then what we can do? As a patient, you don't need to do anything. If your body is resistant to a certain bacteria, the doctor would write a stronger antibiotic for you. And if you are cured, inshallah, then you just need to make sure to follow the healthy behaviors or the hygienic behaviors, not to get the infection again. Because it is not your job to find out if the bacteria are resistant. It is the job of the doctor, if you develop a new infection, to know whether the same bacteria which is resistant comes back to you, or whether it was killed from the course of antibiotic which you took in the first time.
Thank you, doctor. Before we take another question, I just want to tell everyone that currently to our audience, please put your question in the comment section, and doctor will be answering to all of you right here. If you're watching from the YouTube, if you're watching from any of the channels of Prime at from Facebook, please go ahead and ask your questions related to antibiotics, as this is our current topic. Doctor, a very important question. Does hand sanitizers cause antibiotic resistance? And I will ask you another question related to that. Can hand sanitizer help fix the problem of antibiotic resistance?
Yes, as we spoke earlier, hand hygiene is very important because many times we carry resistant bacteria from place to place, and then a new person will get infected with this one. So hand hygiene is very important. Now, there were some talks about overusing hand hygiene because we have what we call it normal flora on our skin, which is a healthy bacteria, which doesn't need to be killed completely. So overusing is not recommended. But now, when we are living in the COVID era, I think if we want to weigh the benefits and the disadvantages of overusing hand sanitizers, I think we should go with the benefits, which is to stop the spread of COVID-19, along with the spread of other kinds of resistant bacteria, like the bacteria we call it MRSA, which spread now in community, like in gyms, in sport activities, because of touching surfaces which are contaminated or not clean. So when you wash your hands, when you use the hand sanitizer, you will decrease this possibility to the minimum. And currently in the COVID era, the golden rule will stand: hand sanitizers, washing hands for 20 seconds or even 40 seconds recommended. This will help to stop the spread of COVID-19 and other bacteria as well. It may impact the normal flora on your skin, but the body is amazing by generating itself in an amazing way.
Mr. Tosif is asking a question. Is there any test to determine antibiotic resistance?
Yes, we do commonly what we call it culture. We take samples from different sites of the body and we send it to the lab, and the lab will be able to tell us what kind of bacteria is there and what kind of antibiotics are resistant to this bacteria, so that we avoid it. Because sometimes we start the patient who is sick on an antibiotic in the hospital. We feel after some time the patient is not improving, and then the result of the culture will come that this antibiotic which we were giving to the patient is not sensitive or is not effective. Whereas this antibiotic is known to be effective, but because of the high rates of resistant bacteria, so it became not effective in this particular case. And this is where we need to change the antibiotic to a stronger one. And there are other tests which are complicated, but the common test is the golden standard is the culture and sensitivity, we call it.
Doctor, there is a question from Ms. Aliza. She's asking, sometimes doctors are first time prescribing two antibiotics. Is this normal, specifically for old age? Also, they do it without antibiotics.
without
Without tests, sorry.
yeah,
Without
okay,
tests.
okay. So it is not common to give two antibiotics. It is in very rare and selected cases where we give two antibiotics to the patients if we found certain types of resistant bacteria. This practice is commoner in the hospital, where we give it against some bacteria, not all bacteria, and we give it when the patient is seriously ill or sick in the ICU or in the hospital. We combine two antibiotics. And in general, there are guidelines at the country level and internationally, what we need to give for the patient. If the patient reaches the level of giving two antibiotics, then this patient, he may or she may need hospitalization to give these antibiotics in the vein. After improving, we will discharge the patient on a single antibiotic. So in the vast majority of cases, it is a single antibiotic. In very selected number of patients, we can give double, mostly for patients in the hospital and not for outpatients. And this question, it will highlight the importance also of the physicians or the healthcare providers, where we need to educate everyone about certain behaviors regarding prescription of antibiotics. So not everything is perfect 100%, and this is why we have, for example, in our hospital and in our prime healthcare group, and a program called Antibiotic Stewardship Program, to tell our doctors to use antibiotics and the right antibiotics only when they are indicated.
Doctor, thank you so very much for this wonderful session. We are almost about to complete a 1 hour of session. Before we end up the session, Doctor, I have a question. What advice you would give to people specifically pertaining to current health trends?
Again, sorry, what is the
What
question?
advice you would give to people
Yes.
specifically pertaining to current health trends?
Yeah, currently we are in the COVID era, and there are some advantages of the restrictions we are following, and about the sanitation, what we call it, infection prevention measures, which is pertaining to the COVID-19. Travel restrictions, which is mandatory, hand hygiene, and social distancing. In general, they don't stop the spread of COVID-19. They also stop the spread of the resistant bacteria. So I think we will live these measures for some time before life will return back to its normal. Even when it returns back to its normal, we need to go back to our old advice, which is hand hygiene, which is take antibiotic whenever it is recommended, listen to your doctor. And again, for the number 10 or 20, I'm talking this webinar about, don't pressurize your doctor to write antibiotic. It is not the solution always. It can harm you either by causing side effects, and many patients, they are complaining from side effects, either anaphylaxis, allergy, vomiting, stomach pain. If the antibiotic is needed, then you should not suffer all of this suffering, and you should just follow the doctor advice. Continue the precautionary measures, because it is very important for your health in this COVID-19 era.
Thank you. Thank you so much, Doctor. There are the information that you have provided in the last 50 minutes. That's really something that every single person should be aware of, and they should know the importance of this especially this topic, because it is something that everyone should know, specifically for the people who take medication at home, who take antibiotics at home without the prescription of the doctor, which you really highlighted in a very good way. And of course, another thing that was highlighted is obviously hand sanitization. Hand sanitization is very important. And talking about obviously antibiotic resistance and what world could face in upcoming years, which you already mentioned, that how many people will suffer in case if it becomes we have more antibiotic resistance going on. Thank you very much, Doctor, once again on this topic. I just would like to inform all the audience, if you would like to consult Dr. Dirar, Dr. Dirar is currently practicing in Prime Hospital. As I said, he's the chair of internal medicine, and he himself is a consultant in internal medicine. You are good to go to call on the number that is available on your screen at this time, and you can book an appointment as per his schedule, and he will be there for you. If you have any questions that you really want to ask us through an email, you're always welcome to send an email at myprime@primehealth.ae, and we will be coming back to you on this, replying. For current topic, as I said, that it is an awareness session, and Prime is all about personalized care personally. And this personalized care personally is something that is we show, and the awareness we spread on under the umbrella of personalized care personally. That's the reason we have done this session for antibiotic misuse and resistance. So thank you everyone for joining us, and we will be coming back to you with another session very soon. Doctor, just before we end of the session, I have just one question coming in from Mr. Lisa. Where can we get the info about antibiotics?
From your doctor. يعني first, if you have any question, ask your doctor. Will help you. And second, follow the websites or the social media of the official health authorities, like the Ministry of Health here in UAE, or like the WHO or the CDC, where you will find the right advice regarding the antibiotics and what common practices that can lead to misusing and causing later on the antimicrobial resistance.
All right, great. Thank you very much, doctor, for your wonderful timing and session, and the whole thing that you have explained about antibiotics misuse and resistance. We really appreciate that. Any websites, doctor, that you would like to refer?
Well, Ministry of Health website is a very useful one, and WHO, they have a very beautiful and easy, simple media to increase awareness of public, and they have a category where they put all the media of the campaign, the World Antibiotic Awareness or Antimicrobial Awareness Week, where they call it WOW. So if you type WHO WOW, you will find this media, which is in all languages actually. You will find in your own mother language, English, and all other languages as well. It is very useful. Some few tips it can help you as well, and assist us as healthcare professionals, and make the job easier for us by cooperating and by being more aware about this issue, which will affect everyone in few years if no action is taken immediately.
Thank you very much, doctor, for joining us. Thank you everyone for joining us.
Thank you.
Please stay tuned for another live session that will be coming very soon on the prostate cancer. That is happening on 29th of this month, and we shall come back to you on the site. Thank you very much. Take care. Bye-bye.
Thank you.